Hi, my name is Madison and I'm going to demonstrate an intramuscular deltoid injection. So first we are going to gather up our needed supplies. We're going to have our alcohol prep pad, our medication vial, and then a 3 ml syringe and a 23 gauge needle. So first we are going to perform our hand hygiene, and then we are going to look at or establish our six medication rights: the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. So first we are going to check our MAR to get our physician order, and then we are going to pull out our proper medication. We are going to check it over, make sure there's no cracks, the expiration date is good. If it's a multi-use vial, we would have the date that it was opened and the time that it was opened, and then initials. If it was open previously, it's only good for about 30 days, so it's important to check those. So first, we are going to clean the top of our vial. We are going to uncap our needle. We are going to withdraw the amount ordered. So in this case, we're going to withdraw a 1 ml. And then we are going to inject it into our vial, injecting our air. Okay, now we're going to eject the appropriate amount per dose, keeping it 90 degrees. Okay, now we are going to get rid of any air bubbles. Okay. So now that we have that, we could eject our needle, and we're going to recap with our one-handed technique. Okay, so now we are going to back up. We're going to choose the appropriate syringe and needle based on the volume and the patient's size, depending on the medication order. Okay, so now we're going to go into our patient's room. We're going to have our patient give us 2 forms of identification, so name, full name, and birth date. Then I'm going to explain the procedure, and the medication. So then I'm going to look for the appropriate site. So with the deltoid, you're going to want to go 3 fingers and right in the middle and holding tight or taut. So it's going to be up in this muscle right up here. So then we're going to position our person to where they have their arm exposed and relaxed to their side, but we don't want them to be like tense. So have them nice and relaxed to their sides. So now that we have them positioned correctly, we're going to have hand hygiene. And we are going to have our gloves maybe. Okay. Now we are going to clean the site with an alcohol prep pad. Okay, in circular motions, allowing the time to dry. Okay, so now we are going to uncap our needle, bevel up between our index finger and our thumb. We're going to inject holding our skin taut and at a 90-degree angle. So then we're gonna just inject, and then we're gonna aspirate it, so stabilizing with our non-dominant hand and seeing if we have any blood return. If we do, then we would take out our needle and prepare our injection over again. But I have no blood return, so I'm going to slowly inject the medication over the next 5 to 10 seconds and taking out our needle, and then disposing of it properly without recapping. So then we could blot it, not massaging, and you can put a band-aid on it. So then you would make the patient comfortable, and you would go out and document properly of the site and of the dose, and then making sure all the call light's in reach and all the fun safety stuff. So